at risk of malnutrition. It doesn't mean that they are malnourished, it just means, these guys are in a high risk category. And here in aged care, we've done some research, and it's about 50% of people in aged care that are malnourished. So I guess by using this tool, you might pick up about 50% of the residents that need some dietitian assessments.
You're going to get busy then?
Yep, that's right.
Got lots of overweight.
And that's a good point as well. Even if someone's overweight, they could still be at risk of malnutrition if they've lost their appetite and they might have lost a couple kilos. They could be at risk. So would you like to practice using the tool on each other? Do you think that would help remembering how to use it? Yeah. Maybe just split up into groups of 2 and just practice asking the questions.
No, love.
I'm not doing it.
Have you lost weight
without trying?
No.
Yeah.
I haven't.
We
do
can
it.
Well, that's what it is. I'm eating healthy, same as without.
No, that's right.
Have you lost any weight recently without trying?
Yes, I lose it and then put it on and lose it and put it on.
Well, I don't even know your drug history.
Oh, okay.
Have you lost weight recently without trying? Oh, yes. How much, my darling?
A couple of kilos, I reckon.
1 to 2.
She did chokers and white sauce, she did all the veggies.
This one is?
I went from 55 kilos down to 53 kilos.
Have you had a decreased appetite or stress?
No, just no appetite.
So you've had decreased?
Yes, decrease, love, decrease.
Yeah.
Hey, you're Julie's daughter, aren't you? I've seen you before.
Julie who?
Morris, from the gym. She used to be my trainer, personal trainer.
You know who she looks like? A younger version of Robin Whittaker.
You reckon? No, we put a line through the week.
Good,
yeah.
Yeah.
Have you done your resident of the day?
No, I haven't done them. I've done them upstairs.
So this one here, she's a 1.
I could probably do one now, actually.
Is that right? What was
One of
the
the
talking
residents.
about?
She,
Is that
I
right?
did more falls.
Have you lost weight without trying?
Yeah.
And then here,
She would score.
So is that what you do?
Oh,
Well, that's because you haven't really lost weight without trying, because you haven't been there.
And she's already on high energy
And you
diet.
are eating
So
about
I
Well, actually, she put on a kilo in the last month, so she wouldn't be.
If you're saying no, the answer is 0.
Am I eating pork? That's it now.
Yeah, she's awake.
And you can write, if there's been a gain or a loss, you can put an arrow. I usually write in this bit.
Will you stand still?
You're doing a good job.
It's gonna be jumpy and all that. The beginning is.
I mean, I generally put an arrow up or down, and then if they've been started on simple, if we've reversed it, then you write that down. But we like that instead of, would that be a first step without having to review?
Exactly, that's the protein
Just give them a bit of boost so they stabilise for the next month and then do it again.
Yeah.
Hers, she's asked me to as well. Sheree, she's asked me to do it for her.
Was that related to the Morris that was in here?
Yeah.
Oh, no. No. Yeah, she was a gym instructor.
What's your dad's name?
Oh, that's the Warren.
Murray.
Neil and Peter.
So that's
But the next time I read it.
So she on this one?
Oh, cool.
And you
No,
get three top ones.
I'll give you mine.
See, sometimes we have two sets of scales here too.
Ah, good.
We have the slim lifter ones, which are a bit
Yeah, they're tricky to use.
temperamental.
Yeah.
Yes.
Scales that you stand on.
And then you also have the chair ones.
Yep.
The chair ones that I think there's a bit of
I
discussion.
don't know.
Sometimes I had someone who was totally
That's not right. You can question that.
I didn't even catch what was going on to it. The truth, I was too busy with this.
Alright, we might come back. How did you find that? Was that easy?
Yeah.
Yeah.
What was that?
How was that?
Yeah.
pretty basic.
Yeah.
But that's what's important.
How long do you reckon that would take you to do with the patient?
Maybe a little bit longer than what it took us to do it.
Depends, yeah. Could take 2 minutes, could take 30 seconds, it could take longer. But I guess
Especially with dementia patients.
Some of you
yeah.
wouldn't be able to do
Not be able to do
it.
it.
Exactly.
And then you can sort of estimate or use your own judgment. But I guess the idea with this tool is that it's quick, it's easy, just 2 questions, and that's what you do to screen your patients. Any comments about the tool? That's good. Yeah, it's easy. So with the dementia patients, do you have any strategies yourself that you could use?
I think you talk to the staff that look after them
Totally.
and go through their notes
Basically, over there
Ask
you can
family,
monitor what
perhaps.
they're eating a lot closer than what you do over here.
Talk to their families, perhaps.
Because they're sitting in one open area over there.
Yeah, we do. Yeah.
Yeah.
Cool. Alright, so we'll go back to our outcome for today, that you could use the malnutrition screening tool and record the results accurately on the assessment paperwork. Do you feel confident that we've achieved that outcome today?
Yes.
So I hope to see some more referrals coming through from you guys.
Alright.
Yeah, so if you...
So are you here in Legion?
Yeah, I'm in Legion 3 days a week and
Okay.
Andrew a couple of days a week. But do you know how to send me a referral?
Just fax it
Fax it through to community health, that's right. Or you could call me and have a chat, but fax
But
it
have you got
to
your
No one answers the phone over there.
Just the general, yeah, just the general community health referral form. Yeah. That's it.
No, I know Paula never answers the phone.
Yeah,
No.
if it's on voicemail then that's...
They don't answer the phone over there.
They don't.
Why don't
You
they?
get, no,
Paula always puts it on message
answering. It's always on answering machine, that's it.
Yeah. I guess we check the messages fairly often, so... Well, thanks everybody for coming along today. Hopefully that was useful for everybody.
Thank you.
So I've got a question.
Oh,
Like,
yeah.
now that's malnutrition. Now overweight patients.
Yep.
So can you refer
Well, tell me
about
about
we've got lots that
That are overweight.
and don't eat properly,
Thank you.
eat rubbish.
Yeah, I guess with our guidelines for people that are over the age of 65, we don't actively encourage weight loss. However, that doesn't mean we can't encourage people if they're keen to eat healthier, but it just comes down to that patient if they themselves are actually interested in learning about healthy eating or making some changes. If
But it's really hard
obvious-
on their knees, you know, to get up and walk. The pain they have in their legs when they have
That's
to
right.
carry that weight is unbelievable.
But it hurts ones that can't walk, it hurts our back.
And then I was
Because
just
when you're
thinking
100
about
shoulders,
you guys.
yeah.
They're putting you in a lift up.
Then you have problems
Yeah.
with family and...
You know.
Yeah, you've got to
And then they're complaining
contend with
because
family bringing in food and stuff as well,
Yeah.
which is
Yeah.
very difficult.
Well, I was actually going to say the next step would be to think of another topic that I could do an in-service on, so I think we've thought of something.
Yeah, that's next one.
But yeah, I guess generally I don't encourage weight loss, but that doesn't mean for residents that want to do something that I can't help them with that, so keep that in mind. But if I could just get some feedback from you guys for that session today, if you have any comments, anything that you thought was good or something that wasn't so great, if you could just call them out, please.
It's probably just the
Very,
importance of the monthly ways.
Yeah.
And getting it, trying to get, achieving an accurate weight.
Yeah, that's tricky. Is there anything I could do to improve these talks, or is this pretty good?
No, you've done very well.
You did well.
Okay. I guess I've tried to keep it pretty casual and practical and short.
No,
You
you've done
remember
well.
better then.
Yeah, that's right. Cool. Well, I'll talk to Beck about doing another session on overweight, so we go from one extreme to the next.
Yeah.
Sounds good.
Thank you very much.
Thank you.
Well done.